Health clinics have several tests to detect and diagnose diabetes, and most often this starts with the more simple method, which is screening. Screening is simply a test looking into the risk factors an individual has for diabetes. This largely includes looking at family history for the condition and looking at the patient's current body mass index. In order to officially diagnose type 2 diabetes, a series of tests are taken. Firstly, a fasted blood sugar test takes place. This test is the blood sample that is taken after an overnight fast to observe a patient's blood glucose levels in a fasted state. Normal levels are less than 5.6 millimoles per liter. 5.6 to 6.9 millimoles per liter is considered pre-diabetic, and then anything above 7 millimoles per liter is now indicative of diabetes. Next, we test how a patient handles glucose through an oral glucose tolerance test. A patient will receive glucose water sample, and after about 2 hours of ingestion, blood sugar is taken again. This is done to observe if the pancreas has successfully increased insulin secretion in order to metabolize the newly ingested glucose. Results of less than 7.8 millimoles per liter are normal, 7.8 to 11 millimoles per liter is considered pre-diabetic, and anything above 11.1 millimoles per liter is highly suggestive of diabetes. Lastly, to diagnose type 2 diabetes, an A1C test, which is also called the glycated hemoglobin test, is then performed to determine a patient's hemoglobin average over the past 3 months. A result below an HbA1c of 5.7% is considered normal, 5.7 to 6.4% is now diagnosed as prediabetic, and 6.5% or higher on 2 separate tests is now diagnosed as type 2 diabetes. Several other tests for diabetes exist, such as the 2-hour postprandial test, random blood sugar test, and fructosamine testing, which is used as an alternative to the A1C test for those with sickle cell anemia.